What if the secret to controlling diabetes wasn't just about cutting sugar, but about adding the right nutrients? In this video, you'll discover the top 4 best vitamins to lower blood sugar and improve diabetes. These are the missing nutrients most people never hear about, yet they help regulate insulin, boost your energy, and lower blood sugar naturally. If you're ready to manage diabetes smarter and faster, stay until the end, because the top 4 best vitamins to lower blood sugar might be the breakthrough you've been waiting for. And if you like and comment on this video, YouTube will get a better idea of what you like to watch and start recommending more videos like this. Now let's start with the first one. Number 1. Vitamin D. Many people managing diabetes don't realize how often vitamin D deficiency gets in the way of real progress. Studies show that those with type 2 diabetes usually have lower vitamin D levels, and this can silently worsen blood sugar control. Think about it. How can the body properly use insulin if it's lacking something so important? Improving diabetes isn't just about avoiding sugar. It's also about supporting what your body truly needs. Health starts in the smallest details, and vitamin D is one of them. Could this missing piece be why controlling your diabetes feels harder than it should? Why is this deficiency so common, especially among older adults? It often comes down to sunlight, or the lack of it. Our bodies make vitamin D when the skin is exposed to sun, but aging skin, obesity, and poor gut health can reduce this ability. And let's be honest, how much sun do we really get each day? Low vitamin D can affect insulin sensitivity and make it harder to regulate blood sugar levels. Managing diabetes becomes even more challenging when your body doesn't have the fuel it needs to fight back. The symptoms aren't always dramatic, but they are real. Constant tiredness, muscle pain, weak immune function, and even a low mood might be signs. These symptoms are often blamed on age, but sometimes they're a signal from your body. For someone trying to manage blood sugar and improve insulin sensitivity, ignoring these signs can delay healing. Your health depends on listening to what your body is trying to say. And what if the answer to feeling better was something as simple as the sun? Vitamin D plays a bigger role in blood sugar control than most people think. When levels are low, insulin resistance often increases, and that makes it harder to control diabetes day by day. If your insulin isn't working well, your blood sugar becomes unpredictable, and so does your energy, your mood, and even your sleep. That's why improving diabetes starts with small tests, like checking your vitamin D. A simple blood test, looking at your 25-OH-D levels, gives you insight that can guide your next steps. Why guess, when you can know exactly what your body needs? Once you have your numbers, it's time to take action. Some people turn straight to supplements, but food can help too. Salmon and sardines are rich in vitamin D, and they're also heart-friendly, which matters if you're managing diabetes. Eggs, liver, and fortified milk or cereal are great additions to your meal plan. Adding these foods regularly can support insulin sensitivity and keep blood sugar more stable. When fighting diabetes, your grocery list can become a powerful health tool. If food isn't enough, and often it isn't, especially with age, supplementing can fill the gap. Doctors often recommend 1,000 to 2,000 IU per day, depending on your blood test. But here's something important. Always talk to your doctor first, especially if you're using medications for diabetes. Even natural vitamins affect the way your body responds to insulin. So take control of your health, but do it smartly, with guidance, with balance, and with consistency. Timing matters more than most people think when taking vitamin D. To improve absorption, it's best to take your supplement with a meal that includes healthy fats. A breakfast of scrambled eggs with avocado or lunch with olive oil on salad can make a big difference. These simple pairings help your body use vitamin D more efficiently, supporting insulin sensitivity and better blood sugar control. It's one of those small tweaks that feels easy but works hard in the background. Managing blood sugar doesn't have to feel overwhelming. It can start with how you build your plate. Number 2. Alpha-lipoic acid. Most people haven't even heard of alpha-lipoic acid, yet it can make a big difference in managing diabetes. While it's not a vitamin, many with diabetes have lower functional levels of it in the body. This matters because ALA helps the body use insulin better and supports healthy blood sugar control. If you're fighting diabetes and feeling stuck, the problem may not just be sugar. It may be what's missing inside. Could this be a hidden key to improving your diabetes naturally? Sometimes, the body whispers long before it screams. But why would someone have low ALA? The answer lies in oxidative stress, something very common in people with diabetes. As the body ages and works harder to regulate blood sugar, stress builds up inside the cells. This can wear down your defenses and make insulin less effective over time. It's not always about what you eat. It's also about what your body fights every day. That's why controlling your diabetes is about more than food or exercise. It's about restoring balance. The signs of low ALA might be more familiar than you think. Tingling in the hands or feet, burning sensations, or even brain fog are all possible symptoms. Some older adults managing blood sugar assume these are just signs of aging, but they might actually point to low ALA levels and worsening insulin resistance. Your health speaks in quiet ways. If you listen carefully, you'll hear what it needs. Could that numbness in your feet be more than just bad circulation? When the body lacks ALA, the risk of nerve damage and inflammation goes up. This makes diabetic neuropathy more likely, which brings discomfort and long-term problems. Blood sugar control becomes harder, and insulin doesn't respond as well. That's why ALA is so important for health. It supports the nervous system and improves insulin sensitivity. Managing diabetes is about more than blood tests. It's about protecting the body from the inside out. And protecting your nerves is a smart place to start. So what can you do if you think your ALA levels are too low? The first step is to eat foods that help. Spinach, broccoli, tomatoes, and even red meat, especially liver, are rich in alpha-lipoic acid. Adding these to your weekly meals can support blood sugar balance and help your body use insulin more effectively. If you're trying to control blood sugar naturally, your kitchen becomes your strongest ally. A warm spinach salad or roasted broccoli isn't just tasty, it's healing. Sometimes, simple meals bring the biggest shifts in diabetes control. But let's be honest, food alone might not be enough, especially if you already have signs of nerve damage. That's why many people managing blood sugar also turn to ALA supplements. Clinical studies often use 300 to 600 milligrams per day to support insulin sensitivity and nerve health. It's a helpful tool, especially if you're dealing with tingling feet or poor blood sugar control. Supplements should be used wisely with medical guidance, but they can help turn the tide. Imagine feeling your fingers again and feeling in control of your diabetes too. To make the most of your supplement, timing really matters. ALA is best taken on an empty stomach or at least 30 minutes before eating. That helps your body absorb more and use it better to regulate blood sugar levels. Pair that with a steady routine, and you might start noticing changes in how your blood sugar responds during the day. Imagine fewer spikes, more stable energy, and better focus, all because you gave your body what it needed. Isn't that what we all want when managing diabetes? Number 3, vitamin B6. Did you know that many people controlling diabetes have low levels of vitamin B6 and don't even know it? This is especially true for those taking metformin, a common diabetes medication. Metformin can interfere with the absorption of B6, and that affects how your body controls blood sugar. Without enough B6, insulin doesn't work as well, and blood sugar may stay high, even when you're trying your best. Managing diabetes can feel frustrating, but sometimes the missing piece is something as small as a vitamin. Could B6 be the quiet hero your body's waiting for? So what causes low B6 in the first place? Poor diet is one reason, but medications like metformin and even diuretics are major players. As we age, our bodies also become less efficient at absorbing nutrients, which makes things harder. That's why people working to control blood sugar need to pay attention to more than just carbs. A balanced diet and awareness of medication effects can improve blood sugar control and overall health. When fighting diabetes, even tiny changes in nutrient levels can tip the scale for better or worse. The symptoms of B6 deficiency can be sneaky. Have you ever felt more irritable than usual or noticed numbness in your hands or feet? Maybe you've had trouble concentrating or gotten sick more often. These signs may be connected to low B6, which directly affects blood sugar regulation and insulin function. If you're trying to manage blood sugar but feel like your energy or focus is off, it's time to look deeper. Sometimes your body isn't just tired, it's asking for help in its own way. When vitamin B6 is low, the nervous system often suffers first, and this is especially dangerous for people managing blood sugar. Low B6 can make it harder to sleep, regulate mood, or even stay mentally sharp. It may also worsen symptoms of diabetic neuropathy, adding more pain or discomfort to your daily life. Blood sugar control becomes harder when your nerves are stressed and insulin stops working as it should. For those trying to fight diabetes, ignoring these effects can hold back progress. Health isn't just about numbers. It's about how you feel every single day. So, what should you do if you think your B6 might be low? The best place to start is with a blood test, especially if you're experiencing symptoms. Talk to your doctor and ask to check your vitamin levels. This simple step can bring big clarity. Managing blood sugar is easier when your body has what it needs to process insulin properly. A few small changes could improve diabetes control and bring back energy you forgot you had. Sometimes the solution is not cutting more, but adding what's been missing. Vitamin B6 is easier to find than many people think. You may already have some good sources in your fridge. Chicken, tuna, bananas, potatoes, spinach, and avocado are all rich in B6. Adding these to your meals doesn't just bring flavor. It helps regulate blood sugar and supports insulin function. Try a dinner of grilled chicken and roasted potatoes, or a smoothie with banana and spinach. Managing diabetes becomes more natural when your meals work for you, not against you. Every bite can support your body's ability to control blood sugar levels with ease. If food isn't enough, or if your test shows low levels, vitamin B6 supplements can help. Many people managing blood sugar use doses between 25 to 100 milligrams daily under professional supervision. This helps improve insulin response and supports nerve health, which is key for controlling diabetes. Supplements don't replace a healthy diet, but they can give your body the boost it needs. Remember, when your blood sugar feels out of balance, nutrients may be the missing support. Always talk to your doctor before starting, especially if you're taking diabetes medications. Here's something many people miss. Vitamin B6 works even better when combined with magnesium. They help each other work inside the body, especially in regulating insulin and managing blood sugar. So, when planning meals or taking supplements, include foods like pumpkin seeds, leafy greens, or almonds. A warm bowl of spinach with a sprinkle of seeds might support both your energy and your blood sugar levels. Little combinations like this make managing diabetes feel less like a chore and more like a rhythm your body understands. And just like that, we open the door to yet another powerful mineral that plays a vital role in this journey. Number 4. Zinc. Zinc deficiency is more common in people trying to manage diabetes than most realize. High blood sugar levels can lead to more zinc being lost in urine, which weakens the body over time. When zinc is low, blood sugar control becomes harder, and insulin doesn't work as well as it should. That's why even if you're eating right, a silent deficiency can slow your progress. Many older adults experience this without knowing why their health feels off. Could zinc be the missing link in your diabetes control plan? Why does the body lose so much zinc, especially with age and diabetes? Poor diet is one reason, but medications like diuretics can also flush zinc out of the system. At the same time, chronic high blood sugar increases zinc loss through urine. This double effect weakens your immune system and reduces insulin sensitivity. Managing blood sugar becomes much harder when your body isn't absorbing the right nutrients. Zinc may be small, but its role in controlling diabetes is huge. The signs of low zinc can show up in ways you wouldn't expect. Do your nails break easily? Is your hair thinning or your skin healing slowly? These are common symptoms, along with frequent infections and poor wound healing, all tied to poor blood sugar control. For someone managing diabetes, these small signs may point to a much bigger problem. Listening to your body could reveal what blood tests might confirm. Zinc is low, and your insulin isn't doing its job properly. When zinc is low, your body struggles to make and use insulin effectively. That makes blood sugar harder to regulate and increases the risk of complications from diabetes. At the same time, your immune system weakens, which can make small problems feel bigger. Healing slows down, infections become more frequent, and your health feels less stable. Managing diabetes isn't just about lowering blood sugar. It's about giving your body what it needs to heal, recover, and respond. Zinc is one of those hidden essentials that brings balance back to your system. If your zinc levels are low, it's time to act. Start by adding zinc-rich foods to your diet and talk to your doctor about testing your levels. People managing diabetes often don't realize how much zinc supports blood sugar control and insulin function. Strengthening your nutrition helps you manage diabetes more smoothly and with fewer complications. It's not just about cutting sugar. It's about building your body from the inside out. And zinc plays a quiet, powerful role in that foundation. Zinc is found in some surprisingly simple foods. Oysters are one of the richest sources, but beef, chicken, beans, and pumpkin seeds are also excellent. These foods not only support immune health, they also help improve insulin sensitivity and stabilize blood sugar. A bowl of beans with grilled chicken or a handful of pumpkin seeds can support your health in real, tasty ways. The more you nourish your body, the better it becomes at regulating blood sugar naturally. Food is medicine, especially when it's rich in zinc. When food isn't enough, supplementation might be necessary. Most people take between 15 to 30 milligrams of zinc per day, but it's important not to overdo it. Too much zinc can interfere with other minerals and may do more harm than good. That's why managing blood sugar safely includes checking nutrient levels and working with your doctor. With the right dose, zinc can help insulin do its job more effectively and keep blood sugar steady. A small capsule can have a big impact when used wisely. To absorb zinc better, avoid taking it with calcium or iron, which can block its absorption. The best time is usually on an empty stomach or between meals, unless it upsets your stomach. Pairing it with a light meal like eggs or vegetables can still help regulate blood sugar without reducing absorption. This small habit can make your supplement more effective and support insulin in doing its job. And now that your zinc is working for you, what if there were even more ways to lower blood sugar and improve diabetes naturally? Now that you know which vitamins help control blood sugar, you might also be interested in learning about the best protein sources to improve diabetes. Click on the video appearing on your screen. And don't forget to subscribe for more tips like this.